certainly here in the States and I think across the globe, is just medications. And each doctor has their favorite medicine, whether antidepressants or anti-anxiety medicines or benzodiazepines. We are essentially making educated guesses, right? We have multiple medications available. Some doctors use an antidepressant, some doctors use anti-anxiety medicines, but they are essentially educated guesses. And not only do our doctors guess at how to start medications, nobody is trained how to stop medications. Because of the concern of benzodiazepine dependence, many psychiatrists and primary care doctors are shifting to the antidepressants as the first-line treatment for anxiety. And antidepressants have an increasing number of side effects, sexual side effects, suicide risk, the weight gain, and then the stopping the medications resulting in antidepressant withdrawal. There's no protocols and no treatment models. But our discussion is with this tremendous increase in depression and anxiety across the globe. This was a survey in June of 2020 last year. 40% of adults reported mental health problems. And here you see over 30%, 1/3 of US adults, anxiety or depression. And whenever we talk about a functional or integrative approach, the core of my practice and my teaching and training for doctors is understanding biochemical individuality. This is that genetic environmental dance, that genetic environmental interaction that results in the symptoms. So these are 5 different individuals. We could all include them as the same age with the same symptom complex that you and I might diagnose as anxiety. But they all might have different contributing factors. And we're going to go through some of those today. We're going to talk about some of these differences. We're going to talk about amino acids and magnesium and vitamin D and inositol and some mindfulness approaches, but different underlying physiology and different treatment models. Everyone's different. So let's start with the premise, which many of us have been trained on, the psychotropic medications for anxiety. And all the medications that we use in psychiatry affect neurotransmitters, right? Increasing or decreasing or keeping around in the synapse longer, whether it's serotonin, the GABA, dopamine, norepinephrine. So all psychotropic medicines affect neurotransmitters. But what is often forgotten are these neurotransmitters, right? The serotonin, the dopamine, they are under precursor control, meaning the substrates, here their amino acids, are obtained from our diet. So we need to understand our dietary intake of these precursor molecules. And protein, here we have meat and egg, is broken down with hydrochloric acid and digestive enzymes from the stomach and pancreas to these essential amino acids. And it is these essential amino acids that go on to make all the proteins in the body. And that includes not every, but the vast majority of neurotransmitters, certainly serotonin and dopamine, norepinephrine. So this is a very simple but very important concept that I just want to make sure we understand, is that neurotransmitters, the entire focus of mainstream psychiatry, they are synthesized from precursor molecules called amino acids that are obtained from the digestion of protein in the diet. Now, a vegan, vegetarian diet with little protein is going to have minimal essential amino acids, which is going to affect levels of these proteins or neurotransmitters. And if you don't have adequate zinc, you're not going to produce hydrochloric acid. If you don't have adequate digestive enzymes, you're not going to break down protein. But our first point is eating adequate protein to be digested to these essential amino acids